Hi, and welcome everyone to the 2021 Miller Prize Pitch-Off. My name is Cassie Tucker. I'm Managing Director of the Tsai Center for Innovative Thinking and your host for today's competition. This is the third live pitch event for Startup Yale, and we are thrilled to have you tuning in from wherever you are in the world. Although this is a virtual event, I want to take these first few moments to acknowledge the land our university occupies and the indigenous peoples who occupied this land before us. Yale University acknowledges that indigenous peoples and nations, including Mohegan, Mashantucket, Pequot, Eastern Pequot, Schaghticoke, Golden Hill, Pocasset, Niantic, Quinnipiac, and other Algonquian-speaking peoples have stewarded through generations the lands and waterways of what is now the state of Connecticut. We honor and respect the enduring relationship that exists between these peoples and nations and this land. In a moment, you'll be seeing these four fantastic teams compete for the final grand prize of $25,000 awarded to the best student-led venture developing innovative tech or tech-enabled solutions. Brian Miller, our generous donor of today's prize, initiated this competition at Yale 6 years ago with the goal of supporting young minds creating innovative tech solutions that will change the world. A big thank you to Brian for his support of the teams you'll be seeing today and the broader innovation community at Yale. Today, to help us select the winner, we have 5 fantastic judges. Jun Chua, founder and CEO of Serval Ventures, Jenny Fielding, Managing Director of the Techstars New York City Accelerator and the founder of The Fund, Raj Gorla, founder and CEO of Cortina Health and partner at Equilateral Ventures, Brendan McGuire, Portfolio Manager and the Director of Research at North Sound Management, and Gary Stewart, founder and CEO of Founder Tribes. Each team will have 10 minutes to pitch, and then we'll open it up for questions from the judges. After we've heard from all 4 finalists, the judges will deliberate to choose a grand prize winner. But the judges aren't the only ones who get to vote today. We'll be asking you, our audience, to vote for the team you think had the best pitch and award an audience a choice prize. We'll announce both the grand prize winner and the audience choice winner online roughly 20 minutes after the last pitch is finished. The first team we'll hear from today is Panluminate. Panluminate, the floor is yours.
Hi, thank you, Casey. I'm going to share my screen in 1 minute. Do you see my screen?
Yes, we do.
And can you hear me?
Loud and clear.
Great, thank you. So good afternoon, everyone. I'm Ons Masad, and I'm a graduate student here at Yale. I'm finishing up my PhD in biomedical engineering. Today, I would like to introduce to you a revolutionary new technology we call Panluminate, which we believe will literally and figuratively change the way biologists see the world. This is a human cell. Biologists view these as the most basic units of life. Cells are incredibly complex, and understanding how they're structured and organized at the molecular level lies at the very heart of nearly all the life sciences, from basic biology to curing disease. To understand cell organization, every scientist since the 18th century has relied on microscopy, making it a $10 billion industry as of 2020. Arguably, the most powerful microscopy method in fixed cells is correlative light and electron microscopy, or CLEM for short. CLEM is a combination of 2 different kinds of microscopes, the electron microscope for structural information and the light microscope for molecular information, making it an extremely complex technique. In 2019, we made a revolutionary discovery with which we can replace images like these with images like these. We call this innovation Panluminate microscopy. Panluminate provides the same information as the gold standard CLEM image, but uses only a light microscope. In addition to that, our images are even clearer, as seen here by the stripiness of mitochondria. But what is even more fascinating about this comparison of images is what you can't actually see here. There are less than 100 clamp platforms across the world. The hardware costs at minimum $5 million. A biological specimen requires up to 10 days of processing and costs up to $10,000 per sample. With panluminate microscopy, however, our technique can be deployed to thousands of labs worldwide. Imaging requires basic and existing light microscopes. Sample processing is on the order of hours, and it's estimated to cost only about $100 per sample. While I won't go into technical details, panluminate is based on patent-pending innovations in biological sample preparation. And because panluminate microscopy is 10 times faster in prep time, 100 times cheaper in processing costs, and 100 times faster in imaging speed, we believe our technology has the potential to be disruptive, taking high-end microscopy from a $100 million market to a multi-billion-dollar industry as adoption and accessibility increases. And we believe that this disruption is analogous to the way next-generation DNA sequencing has redefined the fields of genomics and precision medicine, and that is by delivering the same kinds of dramatic improvements in speed, cost, accessibility, and analytical power. So this is a big opportunity with a lot of potential. And the first step to building a successful business is assembling a great team. Panluminate is a team of Yale scientists and business experts. I'm the product developer and co-founder. Javier Sanchez Cortas is a Yale MBA candidate and our business analyst. Jörg Beversdorf is a professor at Yale, co-founder of Panluminate, and he's also our senior scientific advisor. Thomas Friedlander and James Locker are our senior business advisors, who in the past have mentored many successful Yale ventures. Jörg and Tom have also established records forming microscopy startups. They have extensive experience taking microscopy products from lab to market. So what's our route to market? To answer that question, we performed 37 customer interviews across both academia and biotech in the fall of 2020. We also spoke to the NIH Brain Initiative program in February of this year. And at the current moment, we're distributing panluminate beta products to researchers across Yale with a plan to recruit more beta testers from other universities in the future. From our customer interviews, we learned that most academics prefer to adopt panluminate as a sample preparation kit provider. Among the reasons why academics favor kits, they stated simplicity, since this is something they can do in the lab by themselves. They also believe that the data is of exceptional quality and the technique is dramatically cheaper. Researchers in biotech, on the other hand, were very enthusiastic about panluminate as a sample prep service, especially if we included high throughput imaging and advanced data analytics in the package. When we talked to Dr. Margaret Grab, director at the NIH Brain Initiative program, she told us that there's now an urgent need to include more quantitative and biologically based assays in the drug development industry. Because panluminate microscopy is faster and cheaper than the current gold standard, it can be done in high throughput and at scale, making it a quantitative biological assay. And for this reason, panluminate falls within the technologies the NIH supports. Dr. Grab encouraged us to offer our technology as a service to both pharma and biotech, and she also invited us to submit an SBIR. And so from what we learned in our customer discovery process, we created this following path to market. We envisioned that our first product in the near term will be a sample preparation kit, priced at $500 each and distributed to academic and research labs worldwide. Our second product in the next 2 years will be a sample prep and imaging processing service in the form of a CRO targeting the pharmaceutical industry. And in 5 years, we envision creating an all-encompassing imaging platform with new light microscopes optimized for high throughput imaging, AI software for image analysis, and enhanced data analytics. Our target is $10 million for our first product. We envision getting $100 million for our service product. And our goal is to become a $1 billion business when we launch our imaging platform. As I mentioned earlier, we're already distributing panluminate beta kits to researchers across Yale. Our kit contains chemical reagents, sample handling plasticware, as well as a step-by-step protocol. We also include video demonstrations of critical sample processing steps, and we offer reliable customer support to our users and help them with troubleshooting. Nayoung Kwon, a researcher in the Yale Tsai Center, was my first beta customer. She used our product to image leukemic blood megakaryocytes at a resolution similar to that of CLEM, but at a fraction of the time and cost. Nayoung, a biologist by training, acquired these images without any specialized training and with a microscope that already exists in her lab. With successful results since her first attempt, She called Panluminate transformative, and she asked if we'd be willing to give her another kit. There will be more kits for Nayang and others, and when we get enough analytical data points from kits and services, we will evolve into a platform. Our platform will include high-throughput imaging and deep learning image segmentation. By training machine learning algorithms on Panluminate datasets, we can automatically segment subcellular features across different tissues and different diseases. With this data, we will eventually create quantitative spatial and proteomic reference points for the whole biomedical industry. And so where are we in this whole process? And where do we go from here? Panluminate is an early stage company. This past year, we filed a patent application on the underlying technology, published a Nature Communications paper, completed the Yale Accelerator, incorporated, secured more IP, and we submitted a phase 1 SBIR. At the current moment, we're distributing beta kits to users across Yale, and we're actively gathering their feedback. In the next year, ideally in the first quarter, we plan to launch our first commercial sample prep product. And at the present moment, we're also looking for seed funds as well. We're looking to raise $750,000 to $1 million, depending on our SBIR funding. These funds will be used to support salaries, make more beta products, create an inventory, and they will be used for sales marketing as well. Finally, we truly believe that Panluminate will change the way we see the world. We see our technology having its first impact in biological research. We see this impact translating into discovering new disease mechanism and creating new diagnostic tools. Because Panluminate microscopy is easily deployable, we envision it tapping into the forensics and biodefense markets as well. And Earth is not our limit. Our technology could be used in the future to examine human and microbial specimen by astronauts of minimal training and on planets without elaborate labs. We envision becoming interplanetary. So that brings me to the end of my talk. We are very enthusiastic about changing the way biologists see the world. And if you share this enthusiasm, let's talk. We are more than happy to walk you through more details.
Fantastic. Thank you, Panluminate. We'll now take questions from the judges. Ginny, let's start with you. What questions do you have for Panluminate?
Yeah, first of all, just incredible presentation. Like it was just so well done. So yeah, just amazing. My question is really around the workflows for your kind of first customers. So the researchers and the academics. Is this change? Can you just talk a little bit more about, how they do this now, and does this change any of their workflows, or do you expect there'll be any resistance to kind of using Panluminate?
So right now, to acquire the high-end microscopy images I showed, users will have to contact an imaging facility in their local universities, and then schedule time on an electron microscope and also a fluorescence microscope. And they will usually have someone prepare the samples for them. And this is extremely time-consuming and expensive. Electron microscopy is notoriously very slow, and so that's a huge time sink. Fluorescence microscopy is faster, but then you have to correlate the both images to each other. And to do that, you need very sophisticated software. And so it's a PhD project within itself. Panluminate will make this whole process a lot easier and faster and accessible to any biologist, any PhD student. And they will get the same results. And so in terms of, yeah.
So no learning curve for them to adopt this technology. It's going to be easier and they can just get going immediately. Is that right?
Yes. So Nayang, my first beta tester, is an average. She's exceptional scientifically, but she's trained as a biologist, right? Not a microscopist, and she managed to acquire these images on her own.
Great, thanks so much.
Well, yeah, thank you. That was a great pitch. I guess my question would be, so we know that it's faster and it's cheaper. Can you tell us a bit about accuracy? Is there kind of any loss of accuracy in terms of using this versus the kind of gold standard? And then I guess the other question is, surely there must be other competitors out there trying to kind of move beyond the state of the art. So who are your kind of most worrisome competitors that you think, okay, maybe they may do it slightly differently, but in terms of being able to get it cheaper, faster, and also accurate, these are the ones that we are worried about?
In terms of accuracy, I can actually see this here. In terms of accuracy, for many structures within the cell we imaged, it's highly accurate. And because it doesn't involve any correlative aspect, the correlation of specific markers within the overall structure is very high, right? But I agree that this has to be checked for every single structure. There will be a lot of validation experiments, validation data that we will supply customers to convince them that this is exactly like their golden standard. In terms of competitors, many companies out there, especially in electron microscopy, are trying to make it more high throughput and more accessible to the average biologist. We consider them competitors, but we think we can do this much faster because it's light microscopy based.
Thank you.
Thank you guys for the presentation. This is Brendan McGuire here. So just on the technology, I know we didn't dive too much into the technical details, but just where would you characterize your company as leveraging the existing technology versus like what's proprietary and what's enabling you guys to do it faster and cheaper?
Yeah, so our technology is based really on a discovery. So we discovered that if you enlarge a biological sample and then label its components with a proprietary chemical reaction, you can reveal the same structures that electron microscopy can reveal. And this has never been done before. And so this is the core discovery of our method and its core strength. So it wasn't an incremental advantage, like an incremental step to making an existing technology better. It's based on a brand new discovery.
Got it. Okay.
So that's why we think it's pretty powerful.
Thank you.
You're welcome.
Great. Thank you, judges, and thank you, Panluminate. Let's welcome our next team, Telex. Telex, when you're ready, the floor is yours.
Can you hear me? Yep. Okay. Let me try that again. Okay. Okay. Hey everyone, we're Telex, and we're making a tool that lets users sketch and sculpt to create 3D models. So say you want to get into 3D modeling. You look around online, you download the first product that you find, you open it up, you're a little bit scared because it looks something like this. So this is Blender, and it's a 3D modeling software. And I love Blender because it lets me create really complicated and intricate 3D models. It offers me a lot of power as a modeler, and it gives me a lot of freedom. And the way it does that is by using all these buttons, all these menus, all these different windows and ways that I can manipulate the 3D content. So Blender's great sometimes, but there are times when it falls short. And those times are typically when I want to create a 3D model fast, because then these menus and these buttons actually start to slow me down. So that's why we're making Plasmo, a 3D modeling app that is optimized towards speed, and Vulkan, a haptic glove that adds to the intuitiveness of the 3D modeling workflow by letting users reach into the digital environment and interact with their 3D models as if they physically existed. So the way Plasmo works is you open it up and there's a screen and it's minimalist, and you start sketching a wireframe of what you want to make. So in this picture, this user is sketching the wireframe of a computer mouse. You press a button, and just like magic, that mouse turns into a 3D mesh. Now, where the haptic glove comes in is it lends an additional degree of intuitiveness to the workflow by letting us use our hands, which we're already very familiar with in terms of sculpting and sketching. And these two products together are going to create a much more intuitive, fast 3D modeling workflow. So a natural question to ask is, why do we want to make 3D models fast? And up until now, there actually hasn't been a whole lot of demand for that. The demand for 3D content has been roughly commensurate with the power and speed of existing 3D modeling tools. The industry leaders have a combined annual revenue of about $9 billion. But the key trend is that the market is growing 15% year over year. And where this is really coming from is that we're starting to see 3D content being used in situations where it wasn't previously. So we're starting to see mobile ads. They use these little 3D characters now. A landing page on a website may now have 3D characters on it. Print media, digital media, film, it's gonna start using 3D models. And 3D modelers, including some of the ones that we've talked to, are starting to see their client lists grow. And that's a great thing. But the problem is their workflow isn't picking up pace. They're not able to address that growing client list. So a perfect example of a situation in which a lot of 3D content needed to be made really quickly, or just in general, is two events that happened this past year. So this purple thing here is the Travis Scott Fortnite concert. And the blue thing is the Lil Nas X Roblox concert. And these were digital concerts that happened within the context of Fortnite and Roblox, which are these video games. And what was really cool about it was attended by tens of millions of fans concurrently. And it was a really thrilling experience to be at for me, both as a music fan, but also as a technology fan and a futurist. And everything you see here, all these little 3D models, they needed to be made by someone. And you can see they don't need to be millimeter perfect. They don't need to be dimensionally accurate, but there's a lot of them. And these are the kinds of models that Plasmo excels at. So if you want a 3D model today, here's a representative sample of your options. You have programs like Blender, which I talked about earlier, and Maya, and they're your standard mesh modeling softwares, and they're really optimized for power. So their goal is to give users the greatest number of options when it comes to manipulating 3D content. And that's great for certain applications, but if I wanted to make a prototype of a physical object, a prototype of clothing, a prototype of a shoe, or a digital asset like a video game character, it doesn't need to be perfect. A lot of times I just want to make it fast. So what brings people to Plasmo? The simplest is that it's free. You Google around, you find our link, and you can immediately start making beautiful 3D content. And that's really exciting if you're a new 3D modeler, because you can get right in there, you can make sketches, and all of a sudden you're a 3D artist. You can make this 3D content, and that's something that's really fun to do. And so, what keeps people there? What keeps experienced 3D modelers using our app? Well, as I've said before, our app is intuitive. It's easy to use. Before they were making 3D content, with their way, and now they're making it faster. And our haptic feedback offers a level of control and sophistication and nuance when it comes to manipulating those 3D meshes that was not satisfied by the keyboard and mouse. So we're not the only ones who recognize that a 3D input mechanism is necessary for 3D modeling software. ZBrush is a perfect example of someone else who recognizes this trend. And they are a virtual reality 3D modeling app, but they're made for the Oculus Quest. So they use the Oculus Quest trigger type controllers. And if you've ever used one, for 3D modeling, it's kind of like someone puts a paintbrush in your hand and then duct tapes your hand together and says, go model, this is what you got. And we say, no, you should be able to use your whole hand. You should be able to use your fingers. You should be able to use that sense of touch that you've spent all your life learning. So, and then finally, we're collaborative. Multiple people can work within the same virtual space on the same object at the same time, unlocking even more creativity. So here's what customers are going to be expecting to pay. It's free to get started. Anyone can just go to the website. You don't even need to make an account. You can just start making 3D models. But, our more advanced users, they're going to want storage. They're going to want access to our library of digital assets. So if you want to start with a model of a human head or the Empire State Building or something and build off of that. We can give you those models. And then for our business customers, we offer even more functionality. So, you get unlimited cloud storage, you get that built-in project management software for teams working on large scale 3D projects like a video game. And you get more users who can concurrently use the app at one time. And on the hardware side, the pricing is a little simpler. For $150, you get the haptic glove, you get a charger because we're not the iPhone, and you get access to all the software that we create for it. So who are our users who are willing to pay these prices? Well, we've identified two segments, and we've spoken extensively to users in each of the segments. So customer A is new to 3D modeling. They want to make models for fun. They've spent their life hanging out in Roblox and Minecraft and Fortnite, and they're used to socially engaging with, within these digital 3D worlds. But more importantly for us, they're used to engaging in commerce within these virtual environments. So they're used to paying for digital assets that enrich their lives. And, that's where they're coming from. Customer B is a professional 3D modeler. And they're going to be a bit harder for us to get because they've already invested time and energy into their existing 3D modeling workflow. So there's definitely a switching cost for them. But we're going to lure them away by letting them, not only make gorgeous 3D products, but make gorgeous 3D products fast. They can start addressing more of that demand from clients. They can just unleash more of their creative potential. And additionally, they're going to pay for the ability to collaborate on their models with their team because that's such a huge value add for both them and their clients. So here's where we've been and where we're going. We started work in May 2020, and this past October, we finished the first version of the haptic glove. This past winter, we finished the sketch to mesh algorithm. So that's the magic component that converts the wireframe model to the mesh. About a month ago, we shipped the second version of the haptic glove to the beta users, and they're out there testing it as we speak. A few weeks ago, we decided to show Plasmo to the public, and we posted a video on Twitter of Plasmo in action, and overnight, it got 60,000 views and 1,200 waitlist signups. And we're so excited to launch Plasmo to these users and fans in a month when the software is ready. So we look forward and we see collaborative modeling on the horizon. As I mentioned, we see that glove-based modeling interface. And then eventually we're talking full virtual makerspace. So who are we to make this happen? I'm Tim. I graduated last year with a degree in physics, and I work on the haptic glove as a mechanical, electrical, and embedded engineer. My partner, Antonio, he's on the software side. He has a background in 3D graphics, and he's the perfect person to bring Plasmo to this world and deliver it to all our fans. So we're so excited to introduce you to our vision of what 3D modeling will look like in the future. So yeah, let's stay in touch.
Well done. Thank you. Let's take questions from the judges. June, why don't you kick us off this round? What questions do you have for the team?
Sure. This is really interesting, and I like your dual approach. I think that's really smart. But can you tell me a little bit more, because there's we've all seen a lot of haptic gloves starting to come onto the market, right? And I understand this is a little bit different. Does your business model, are you seeing it as the haptic glove actually has to be incorporated? Are you thinking about taking the Plasmo as an API, right? Because I think the Plasmo is where there's real potential, because taking that design element and converting it is really hard. And there's not a lot of people, I think, focused on that.
Yeah, totally. So we see this as one product, which is a faster way to 3D model. And the role that the haptic glove is filling here is a supportive role. So whereas our competitors in the haptic glove scene are kind of producing the haptic glove with a more general purpose intention, ours is designed to support Plasmo. So Plasmo is the key killer app here. And you're right about Plasmo being where the potential is, to really grow as a business. That's that SaaS model that we've seen succeed over and over again. And yeah, users are going to buy Plasmo. They're going to buy Plasmo, but once they've bought it, they're going to buy the haptic glove because it unlocks just that extra degree of control and creativity for them. And not everyone's, going to have a need for the haptic glove. So certainly there are going to be paying Plasmo users that are not going to buy the haptic glove, but there are also going to be those who do have a desire for the haptic glove, as our customer research has suggested.
Cassie, could I follow up with another question?
Yes, go ahead.
Can you just talk a little bit more about what this virtual makerspace is you envision it to be?
So I think that's actually a great question for my partner, Antonio, who's here to answer questions. Is he? Okay.
Muted. Sorry. Yeah, so the question is, the question is, what is the future vision? And we really believe that the ultimate 3D modeling experience is sketching and sculpting with your hands. So, so it's basically like the movie Iron Man, where Tony Stark uses his hands to interact with 3D models in 3D space and sculpt and create sketches, and automatically some computer algorithm generates 3D model for him. So we believe that this is where future is going, and we're excited to making that happen.
Next question.
Hi, thanks again. That was fantastic. And I just had a quick question about the pricing. And thanks for uploading those videos on your documents for us to get more insights. I also looked at ZBrush, and how did you come to the, I think as June mentioned, it'll all come down to Plasmo, right? In terms of subscription pricing of the Plasmo. Well, ZBrush is about, I don't know, $40 to $50 a month. Well, this product is clearly superior than that. And you're at some point of time, you're going to get to the collaborative modeling. Are you envisioning a professional license of $10 a month as an initial subscription pricing and then changing it at some point of time? Because you are underpricing at this point of time, right? I'm just curious as to what the logic behind is.
So pricing is the needle that is going to fluctuate the most over the coming years. When we enter the scene, we want to be competitive. We want to get people on board, but like any SaaS app, they update their pricing if they know what they're doing, like weekly or monthly, in response to customer trends. And we intend to do the same. So, I think ZBrush is a bit more like enterprise oriented than we're kind of starting out. So that's why they can afford to charge that premium. But there's certainly a future in which, we compete directly with them for that market.
Okay, thanks.
Hey guys, great job on the pitch. Really enjoyed this. I've invested in a number of like 3D printing companies and things that are, appealing to kind of a certain demographic of tech people, but harder to kind of come into the mainstream. So can you tell me like what you think this, what will make this the must-have versus the nice-to-have product that will enable you to kind of scale and reach, the everyday person?
Yes, I agree that currently 3D modeling, 3D printing, this kind of 3D technologies are still kind of niche within like hacker, maker, small communities. But we believe that there's huge potential in that. So the kids who grow up playing Minecraft and Roblox all day will need a new generation of creativity tools. They will interact and create digital media in a fundamentally different way. And we are providing that tool for that future generation who believe will exist in virtual multiverse and create these 3D assets. And and there's a lot of proof for that in like gaming, social gaming trends, and we are very excited to build that for them.
Okay, great, thanks.
Wonderful. Thank you, judges, and thank you, Telex. Up
you.
next, we have Team Flo. Flo, whenever you are ready, the mic is yours.
Awesome. Thank you for having us. Pulling up the deck. Great. Can you see that?
Yes,
Awesome. Should I just get started?
whenever you are ready.
Hi, we're Flow, the smart solution to ice dams. Ice dams form when melted snow flows on warm roofs and freezes at the roof's edge. This leads to the formation of a wall of ice that prevents runoff from discharging. As the standing water accumulates, both pitch and flat roofs can leak or even collapse. Ice dams are a massive problem in the United States. Each year, there are over $9.5 billion in damages. Here at Yale, there are over 400 buildings on campus, and there are ice dam leaks in every single one each winter. The damages annually cost over $1 million. Existing solutions fail to solve the problem. Customers can install heating cables before the start of winter, or hire steaming services after each snowstorm to prevent ice buildup. If they do not, they're often forced to replace a large portion of their roof. Yet roofing is one of the top 3 most dangerous US jobs that has some of the highest insurance premiums. All these solutions are terribly costly, energy demanding, unsafe, and often labor intensive, which poses significant liability risk. With support of the NSF I-Corps Regional Node Office at MIT and the Delta V Accelerator, we've already connected with over 200 potential customers through primary market research. Ice dams affect numerous customer segments, including homeowners, commercial property owners, and the military. Customer interest became particularly evident when we sent a few emails to listservs in small towns of Vermont and New Hampshire on finding folks to try our solution. We received over 50 calls and emails from property owners desperate for a new solution in under 2 hours. We're initially focused on B2B sales to commercial properties, since commercial property owners are less price sensitive and are often more inelastic. They often have large portfolios of buildings with a central buyer, and they are far more invested in data-driven solutions. Existing solutions seek to remove all of the ice, yet this is costly, energy intensive, and unnecessary. We focus on the core issue, discharging the melted snow. Our automated system periodically pumps a liquid de-icer onto the roof to create channels in the ice dam and let the standing water escape. This de-icing fluid is clear, non-corrosive, biodegradable, and pen and plant safe. Here you can see just how effective the de-icer is at penetrating the ice. The fluid was dyed blue for this demonstration, but it's clear and odorless. Flow is a smart, clean tech solution that leverages IoT sensors, online real-time data, proprietary algorithms, and machine learning to eliminate ice dam damage. The IoT sensors we developed can detect key parameters on the roof that are associated with ice dam formation. Flow also processes real-time data from the National Weather Service to determine exactly when to deposit the de-icer. Using proprietary algorithms and machine learning, our system can optimize product performance over the course of the winter. These digital technologies ensure Flow's system is far more effective in preventing ice dam damage. Flow also eliminates the dangerous risk of having high-power electricity systems operate on wet roofs. Flow is also designed for install and forget. The maintenance is simply replacing the fluid cartridge once a year, while the tubing lasts over 10 years. It's invisible from the ground and can be easily installed by any roofer or contractor in normally under 2 hours. We eliminate the risk for roofers to risk their lives in these icy surfaces in the winter. Flow's novel solution drives down carbon emissions less than 1% of benchmark solutions. Yet by taking a data-driven approach, we can even further optimize energy and de-icing fluid consumption. We're currently generating revenue from product sales. Once in production, we project to sell our commercial system for $1,800, where we maintain very healthy margins. An in-cartridge model for our de-icing fluid for $1,000 a year will provide us sales year after year. We will also offer clients, such as commercial property owners and managers, with dozens or hundreds of buildings, a SaaS dashboard to track their fleet's performance. The subscription platform provides unparalleled oversight and real-time visibility on ice dams across their buildings. Lastly, we're developing a nationwide network of providers with regional roofers and contractors who will promote, install, and annually maintain Flow's product for our customers. By discharging the water, rather than removing the ice entirely, we deliver significant savings compared to existing solutions. Flow reduces operating costs for customers by more than 40% annually. The product delivers an ROI in less than 2 years. We provide property owners and managers the asset protection and peace of mind they need. We've previously successfully tested a dozen prototypes in 5 states. We've also conducted studies in cold chambers at MIT and with US Army's Corps of Engineers Cold Regions Research Engineering Laboratory. We're now currently wrapping up a 50-unit paid pilot with universities, municipal governments, major REITs, top ski resorts, and property management firms in 10 states this winter to finalize validation and prepare for launch. These buildings are located across New England, the upper Midwest, and near major ski resorts in the Rockies. We're now already an approved vendor with numerous key customers, including Prologis, the world's largest warehouse owner, the Hyatt, and Vail Resorts, one of the largest ski resort companies. This pilot is designed to finalize technology validation on a larger scale and optimize product performance. All of our units connect to a cloud database using Wi-Fi and LTE connectivity, where we can visualize the sensor data in real time. We can then send over-the-air updates to optimize our algorithms to improve efficiency. In addition to technology validation, this pilot was critical to understanding sales cycles and learning how to sell to commercial buildings. It also validated customers' willingness to pay. We've already generated more than $15,000 in revenue. Our customers paid for the beta version of our system, knowing that we're still finalizing technology testing and validation, which attests their desperate need and excitement for Flow's alternative. They've been very excited by the results and are eager to purchase more units once we're in production to protect the tens of thousands of other buildings that they own and operate. We're developing a host of partnerships to help us scale. For instance, we're working with one of the oldest green de-icer suppliers in the United States. We've also partnered with de-icing industry leaders that already have contractors and thousands of customers nationwide. As we scale, we aim to become the first ice dam solution to secure insurance rebates for our customers. There are also many green organizations that are excited to work with us, including CORE in Pitkin County, where Aspen is located, and Efficiency Vermont. For instance, CORE is thrilled to cut back on the major costs and electricity bills racked up by heating cables, the current solution for ice dams. They recognize that these products are among the largest energy hubs in the county. Given their excitement for our eco-friendly alternative, they've subsidized Flow's pilot for Aspen customers this past winter using revenue from the carbon tax. Flow is also the first startup in Yale history to win all three of the university's major environmental prizes. As we wrap up our pilot, we're rapidly preparing to launch. We will first start selling through our existing customers and establish partner channels to commercial buildings, and then scale with direct sales to key customer segments. We have several key defenses as we scale. In terms of IP, we've already filed several provisional patents on our technologies and are currently prosecuting a utility patent with the USPTO. We also filed the PCT in 2020 and will be proceeding with national filings later this year. Lastly, we're now preparing to file a couple of additional provisionals on our new IoT sensor technologies. All of this IP is exclusively owned by Flow. We've also developed the world's largest ice dam dataset. In addition, we've created key partnerships with industry leaders, insurance agents, and the US military. Flow delivers a strong ROI to customers to install our system to protect their properties from ice dams. Our commercial customers have emphasized, though, that they're also eager to leverage our IoT sensor data for greater facilities management year-round. With our sensors installed, our integrated system can provide value year-round as we scale, ranging from leak detection to thermal mapping to providing insights on solar coverage. This will build further efficiencies into these buildings and establish Flow as the nest for the building envelope as we develop larger and larger data sets. Our solution will have applications far beyond ice dams. We envision expanding to numerous verticals to radically transform the global de-icing industry for the 21st century. We conducted extensive market research to validate its size, as well as filed IP and create key partnerships in these domains to pave this path forward. Our team met while MIT engineering students, and Hector and I are now both engineering PhD students at Yale. We're passionate about applying our balanced set of business, technical, and manufacturing skills to support customers for years to come. I work in business development and venture capital at Air Liquide, as well as at several startups. I'm also currently a managing partner at the Dorm Room Fund. I was named to the Forbes 30 Under 30 Energy list for 2021 as the CEO of Flow. Hector is one of the best engineers I know, and he's an expert in mechatronic systems who previously worked at Dassault Systèmes and Sikorsky. He's leading our technology development. Mitch is a stellar manufacturing engineer who previously worked at Milwaukee Tool, L'Oreal, and the Sazerac Company. He's leading our production and supply chain efforts. We also have a strong team of Yale and MIT undergraduate interns and a host of advisors with complementary backgrounds, including green technologies, insurance, property technologies, venture capital, sales and marketing, and IP strategy. Once we finalize our winter pilot and incorporate customer feedback into our optimized redesigned product, we'll raise a $2 million seed round from several VCs and angels later this year. This funding will carry us through production to scaling our sales. We will reach profitability in 2023 and then only continue to scale. As we reach this inflection point, the Miller Prize will be key to our success. Coupled with funding to date from Yale, MIT, and NGOs, it will finalize our product's design and preparations for manufacturing. The cash prize is critical to fill our funding gap and would be the final funding necessary to fully prepare us to become investor ready. Thank you. We're Flow, the smart solution to ice dams.
Great. Thank you, Flo. Let's move to questions. Gary, if you'll kick us off, do you have any questions for Flo?
Yeah, no, first of all, really great pitch. Like you covered all of the major points. I guess the only question I really had was, who's your biggest competitor, not in terms of kind of like the traditional approaches, but in terms of more technological approaches? Like, who are you most worried about and how are you better?
Well, quite frankly, there, like I mentioned in the pitch, there's really no technologies on the market that seek to solve this problem right now. There are the folks who climb onto roofs and try to steam off or scrape off the ice in some way, or there are heating cables, which are essentially a large heating filament to heat the roof up and try to melt the ice and snow. Nobody's really taking a data-driven technological approach to solve this problem currently. And so a lot of the incumbents in the market right now have been doing the same thing for decades at this point. And a lot of these folks are actually really interested in our solution because it's far safer, it's a lot more cost effective, and it's just a lot more effective in actually preventing the damage itself. And so when we present this idea to folks in the industry, they're just wondering how they can partner with us. And so that's actually how we've developed so many partnerships so early, essentially.
Excellent. I'll take the next question. Thank you, guys. It's a multi-part question, but it really has to do with the device and also pricing. So on the device, given you guys have some pilots engaged, I'm guessing you have a working prototype. So maybe just kind of comment on that. And then also just to help visualize the device. So is it one device per building, or could one device de-ice several buildings? And it kind of as a natural follow-up to that, like how much de-icing fluid can be generated from each device?
Yeah, for sure. So to tackle the first question, so it's one system per building, depending on the size of the building. So we currently have a working prototype, like you noted. In past years, we had conducted around a dozen tests in 5 states. This past winter, we completed a 50-unit paid pilot. And so we generated more than 15K in revenue from paying customers across the country. And this includes municipalities, largest warehouse owner in the world. So it's a REIT, a number of property management firms, a number of other commercial players as well, a number of ski resorts. So really top players in the space who, after this pilot, are really excited to purchase more, both for its cost savings, its effectiveness, and for its environmental sustainability. And so in terms of the system itself, one of the key points we're actually leveraging these IoT sensors is to actually minimize the amount of de-icer used. So a lot of current de-icers in the market are glycol-based or like magnesium chloride, which is really bad for the environment. And so that's what you use for like rock salt on roads and things of that sort. We're actually partnered with one of the oldest green de-icer suppliers in the United States, who's been producing this de-icing fluid for eco-friendly runways and places of that sort. The issue is that's a lot more expensive compared to like glycol-based or magnesium chloride-based solutions. And so the nice thing about our system is that we're leveraging these IoT sensors to bring the fluid amount you need really down to a negligible amount, so around 10 or 15 gallons per winter for an average building. And so by leveraging these technologies, we're able to really cut down the cost for customers as well as on the environmental footprint as well.
Got it. And just a quick one on the pricing. So what is the pricing model? Is it an upfront for the system and then like a software type above that, or how are you guys pricing it?
Yeah, so we have 4 key revenue streams. We have the upfront cost for the system itself. Then we have the recurring revenue from the fluid itself, kind of like an in-cartridge model. Then we have a SaaS subscription for the software. And so we're originally just monetizing that basically on a facilities management platform. You can integrate with existing facilities management platforms and then basically provide data over the course of the winter on whether these things are operational, which is a huge value add for both customers as well as property managers, just in terms of time saving and understanding what's actually going on the roof. And then we ultimately hope to scale that into leveraging these IoT sensors year round in order to provide other data on facilities management on the building envelope. And then the fourth piece is this provider network, essentially, where they'll essentially provide us a annual kickback based on just maintenance and just like replacing the fluid and things of that sort, essentially.
Thank you.
And then very, very interesting. I think this is great. My question is more around, can you talk a little bit more about your bigger data strategy? Because you're clearly thinking ahead about all the different data inputs and potential for that. And then also longer term, can you, or, you know, you're already thinking about your next raise, getting investor ready. So you're very savvy about the path that you're taking. Can you talk about your, any exit strategy if you have one?
Yeah, for sure. So in terms of the data play, I mean, I think that this ties very much into our exit strategy. Building roofs and building envelopes are really have been neglected for a very long time. A lot of folks within the built environment space, both in VC as well as just like operators, have very much focused on Class A type buildings, like these, like the really nice lab buildings you expect at Yale or other universities in big cities. But people have really neglected retrofits and buildings that have not been built in the last 10 years. And building envelopes ultimately account for 10% of US energy usage. And so there's a ton of energy that's being lost in these buildings currently because nobody's really looking out for them. And so we really believe that we can provide a huge value add to these customers. And we've spoken to a number of folks, again, like Prologis, largest warehouse owner in the world, a number of other REITs, a number of other folks within the property space who recognize that they're losing a ton of money and energy right now because they're using really energy intensive solutions, cost intensive solutions as well. I mean, just to get a roofer onto a roof costs $500. And so if you have a drain clog, the only way you find out is you have a leak into your building essentially, or you were lucky enough to send someone up at the right time. And that's just really not an effective way to solve a problem. And so they recognize that, and they want data in order to provide them more personalized recommendations on how to manage their buildings, both from a day-to-day facilities management perspective, knowing whether there are leaks or drain infrastructure and things of that sort, to like longer-term CapEx projects and informing how can you actually better maintain these buildings through thermal mapping, through solar coverage and things of that sort. So you can apply solar panels and really develop a more energy efficient building. And so there's really a ton of value add here that we can provide to our customers. And I think same way that a number of other companies have either IPO'd, SPAC'd, or been acquired in recent years around their data. So Latch, for instance, Nest, for instance, I think there's a huge data play here that we can leverage that doesn't not just affect flow and ice dams, but affects buildings year round, from everything from leaves to pollen to just other just debris that ends up on roofs and can cause major problems in terms of air leakage and things of that sort.
Great. Thank you, Team Flow and judges. Last, but certainly not least, we have our final team to present today, Control Trial. Control Trial, whenever you are ready, the floor is yours.
Good afternoon, I'm Guanan, founder and CEO of Control Trial. I'm representing the whole team today to explain how Control Trial can solve a big problem, clinical trial patient recruitment. With Control Trial, weeks and months become hours. Millions of dollars will be saved, thereby recruiting the right patient to the right trial right now. Clinical trials are the cornerstone for developing new treatment and additional use of current medications. Patient recruitment is essential across all phases. If a clinical trial fails, it has serious scientific, financial, and ethical ramifications. The US spends about $1.8 billion per year on patient recruitment for clinical trials, but nearly 80% of clinical trials fail to meet the enrollment timeline, and 50% of clinical trials delay due to patient recruitment. Let's zoom in and talk a little bit more about the pain point in the patient recruitment process. From the left, sponsors are depending on research hospitals to recruit patients for clinical trials, while from the right, patients are looking for the best clinical trial for their conditions. Providers and research staff are the gatekeeper to match them together. However, the clinical team has so many responsibilities, and it's nearly impossible to always stay on top of all the trials and review every potential candidate manually with limited resource and under tight timeline. Research centers are investing to improve the efficiency of this process. They repurpose the use of some utility from the electronic health record, EHR system, but the result was not accurate enough. So still need a lot of manual chart review. I know this because I worked in Epic for over 6 years, and I led the clinical trial patient recruitment tool development. We have completed over 80 interviews with different stakeholders, pharmaceutical companies, contract research organizations, and hospitals. We interviewed different roles in the hospital: doctors, nurses, IT managers, and research coordinators, also in different specialty areas: cardiology, pediatric, internal medicine, and oncology. As Dr. Taylor, Director of Clinical Research in Pediatric Department said, it still takes a lot of manual work. Also, Dr. Foster, oncologist and hematologist, states the research coordinator plays the key role in the workflow to connect patients to clinical trials. And the best timing to educate and recruit patients is when the patients are in the doctor's office. Therefore, they need a real-time, more efficient, accurate, and equitable way to screen the patient for the clinical trials. Control Trial can help. Our software analyzes clinical trial eligibility data and real-time patient data using artificial intelligence and natural language processing technologies to extract tens of thousands new clinical data points, turning fragmented medical document into unified patient graphs that contains all the information needed to match complex clinical trial criteria. It does not only improve the speed and efficiency, but also the accuracy of patient matching. Our software stays within the healthcare organization's network. It's HIPAA compliance protecting patient information, and access will also be controlled by the IRB review for particular clinical trials. Here's a demo of our working prototype. After submitting the clinical trial eligibility to the system for coordinator, they don't need to wait weeks and months to start matching patient. They could start in hours. All potential matched patient will firstly fall under identified bucket. After coordinator open the patient chart and confirm the highlighted information, they can reach out to the patient and move them to the next step of the recruiting process. For physicians, they will have a list of most feasible trials for their upcoming patient in order to provide the best treatment. This also demonstrates how naturally our software integrates into the current clinical workflow. We recently completed the pilot project using openly available patient clinical data and a set of selected clinical trial criteria. Also, we are finishing up a retrospective pilot study on patient identification for 2 colorectal cancer trials with Yale Smiley Cancer Center. After that, we will continue our pilot project with Yale New Haven Health on other specialty areas. Also, we're discussing pilot projects with 2 other cancer centers. We are very excited to share some preliminary benchmark results from our current pilot project. For the study, first, our system identified potential candidates for the select trial. Next, we have clinical team help confirm their eligibility. And then we calculate the matrices. Compared to the current patient workflow, 40 times broader population were screened by our system, and 85% more candidates were identified. We saw an 18-fold increase in efficiency and a 94.5% accuracy in matching patients. We will preprint our study result very soon and then submit to a scientific journal. Christina is the clinical trial manager of Yale Cancer Center and the collaborator of our pilot project. Here I quote some of her comments. This tool has great impact. Real-time analysis is crucial to match patients because their conditions are frequently changing. It can greatly improve efficiency and increase trial participants. As an early startup, Control Trial started January 2020, recently incorporated, has already received several recognition in a very short time. From Tsai CITY, Startup Yale Rosberg Award, Connect Innovation Biopipeline Award, Innovate Health Yale, CT Next, and Connecticut Bioscience Accelerator. After finishing our current retrospective pilot, Smiley Cancer Center encouraged us to quickly implement our software within Yale to benefit the community. Further, there are several studies already lined up or ahead. That's why we want to win the Miller Prize to help us ramp up our operations. The market opportunity is huge. There's a global market of $5.6 billion US for patient recruitment every year, $1.8 billion for the US. We chose oncology patient identification for clinical trials as our beachhead market, as 40% of clinical trials are oncology related. We did a bottom-up calculation. The size is around 70.2 million per year in the US. Although there are competition in the space with current pilot project with Yale Smiley Cancer Center, we believe we are still in great position. Remember that the best timing to educate and recruit patients is when the patients are in the doctor's office. Compared to other vendors in the market, Control Trial is focused providing state-of-the-art software solution around clinical trial patient recruitment to providers and research staff in the research hospitals. Especially our system designed to seamlessly integrate into the current clinical trial patient recruitment workflow, analyzing real-time patient data, and could be scalable to cover different disease area and at multiple sites. To scale up our business, we will provide our services in 2 steps. First, for healthcare organizations, we will provide consulting services to help them identify gaps in their current workflow. Next, we will conduct pilot projects and provide our software services to integrate into their system to cover different specialty areas. Next, After establishing partnership, we will develop new services with healthcare organizations together for sponsors, such as clinical trial design, and we will share the revenue. With more sponsors on board, we will expand our services to their other sites. Here's our financial projection aligned with our research, software development, and pilot project. By far, we got some non-dilutive funding from the competition award and public grants to support our prototype development and current pilot project. We will submit our SBIR Phase 1 application this December and SBIR Phase 2 application to follow. We have also connected with multiple venture capitals and angel investors, and we will raise our seed round after we complete our current pilot project. Further, we target to get our first paying customer later this year, expand to more specialty area, and scale up to more customers. We are a focused team with great mixture of background, science, engineering, and business. With tens of years experience in clinical research, healthcare, and software development, we share the same faith to solve this challenging problem. I'm Guanan, current third-year PhD student from Department of Computational Biology and Bioinformatics. My co-founder, Hongyu, got his PhD in computer science, previous colleague and friend during working in Epic. Now he's leading machine learning and natural language processing development on EHR data in a public insurance company. Jerome is my PhD classmate from CBB, and with his previous experience at Roche and venture capitals, he's leading the competition strategy and marketing research. We also have several interns and part-time contractors working with us on software development and on business side. Further, we have lined out great advisors. They can guide us through the pilot project in the right way. Now, think about it. At this moment, there's a cancer patient waiting to find the right clinical trial, and we can help. So please do support us. Thank you for listening. Control trial, right patient, right trial, right now.
Great. Thank you so much, Control Trial. Let's move to our last round of judges' questions. Reminder to the audience, feel free to put questions into the Q&A feature. And while the judges are doing their final deliberations, the teams can answer those questions. Raj, if you'll kick off our last round, what questions do you have for Control Trial?
Hey, Guanan, thanks for that presentation. And I noticed that you had worked with Epic and some of your team is connected with Epic, having led digital health firms in analytics and Introp in the Epic ecosystem for the past 2 decades. I understand the challenges. Epic has been our biggest partner and our competitor and barrier in our journey. So my question to you is bifold. One, I understand that data quality and data interoperability are the biggest challenge in terms of, you mentioned access to live EMR data, and accessing live EMR data through interoperability or HL7 Fire is an organizational challenge at every hospital you go to. Just because you have spigots into Epic at Yale New Haven does not mean you can replicate that, because every hospital we've been through the same challenge, right? So one, I want to ask as to how you're going to scale that data aggregation in terms of moving from, let's say, an Epic, which probably has about 60% of records, to Cerner, to Allscripts, how you intend to scale that. And two, my question is, given that Epic is making its own advances in clinical trial research with its research module and its Epic Cosmos database with 60 million de-identified records, how do you see that? Are you already on the Epic App Orchard? How do you see that co-opetition competition working out? So, yeah.
Yeah, I think I can maybe Hongyi, do you want to answer this question? And I can chime in a little bit later. Okay, I'll get a question. I think Hongyi is offline. So I think thank you, Raj, for the question. So the first question, we are working on a common data model. So in regard is the OMAP CDM that we're working with. So as you said, there's a challenge. I think this is a common challenge for all the healthcare and analytic company that to work with the data. So that's why we choose this common data to work on. So this is a similar model I observe when I work in InterSystem. So we have a common data model, and then the implementation for different vendors will be, some actual work to implement on the interface to get those data into common data model. So our product will be automatically be working immediately after that. So I think that part, for now, this is a expanding community that are adopting the OMAP common data model. So we'll go there as our beachhead. We'll reach out to those customers as our beachhead. We'll go there first, but also later on, I think this is also how I want to highlight is this is like the vendor independent. So we are working on a common data model. So that doesn't only mean that we can work on Epic. We can also working on other EHR vendors that provide the data. We're working on the data mainly. So remind me, what is the second question? Oh, in the marketplace, how? Okay, the second question is about what's the relationship for us with the Epic? I think as you mentioned, they have a marketing place. I think the one differentiation I want to point out is Epic or other EHR vendors, their focus is on the clinical side. So they are supporting the daily operation of clinical, seeing the patient and getting the billing document into the system so they can submit to the claim insurance company. But our focus is more on the research side. So that means that clinical trial patient recruitment. So this is the mainly difference between us and the EHR vendors. I think that's with that being said, even Epic has a broader, growing I think interest in the operational or data analytics. I think that those are still mainly focusing on the operational, and so for us I think it's the main difference from us. But I think you're right, because after we have Yale having our product implement, I think one of the next step I want to do is I will invite our physician advocates to the user group meeting in Epic, and I will let the physicians speak for us, and they will tell the story how this is helpful. So there we can expand the network to go to other Epic customer. I think as a demonstration. So there's a potential collaboration. Thank you. But yeah.
Yeah, thanks, Gwen. I would like to add on a little bit because I think for our ventures, we provide very specialized, very laser-focused service. Unlike other vendors, they have like one-size-fits-all solutions. So that's the one thing. The second is about the service. We actually provide the consulting plus software service, which is completely different from other vendors. And third, I think the development process is a little bit different. So we are actively working with the clinical team. So we are developing this process together. So I think that's something we are different from other competitors. Also, in terms of the product itself, we are very lightweight. So we didn't sell a bundle. So that means we are better off in terms of price. Yep.
Thank you.
Hey guys, great job on the pitch. I'd love to continue on this thread of competition. I'm less concerned about Epic and some of the big guys, but this last year I think has shown us all that clinical trials are super important, and that means there are many little startups that are popping up that are kind of entering this space. And so could you tell me a little bit more about what you think would be kind of your moat for a platform like this? Because I am seeing a lot of different variations of streamlined clinical trials platforms.
Sure. I think I would take this question. So I think there are maybe three big aspects for our venture. So first is the technology itself. So we actually provide in-house service, so which means that's very secure inside the hospital. And also we provide the real-time analytics capabilities. So basically we will analyze the data, right away. And also because our service is using common data model, that means we are scalable. So that's the technology aspect. We also provide very unique service, as I mentioned before, because we are providing both the consulting and also the software solution. And the last is about the people itself. I think our team is very unique. As you can see, we actually have experts from Epic. So they have a very good understanding about this EHR, healthcare ecosystem. And we also have very strong scientific advisors working in Yale New Haven Hospital. I think there are several points in terms of competition with other.
Thank you, Jerome. I think one thing I just want to add is that we are not only understanding the technology. I think one of the key to success in this field is understand the workflow. So as I mentioned in my slide, so one is the best timing to actually introduce the trials to the patient is when they are sitting in the doctor's office. So I think that's one of our, I think a differentiation from others. Others, I think there are vendors, they are analyzing like patient data from claims data from the insurance company. That's not real time. That's just a snapshot, of the patient condition. The condition are changing every day. So that's why we want to use this real-time data. And then we are analyzing ahead of the patient's schedule. So that means for the next week, the patient are coming to see the doctors. We will provide the information beforehand. So the coordinator can verify and they can present this data to the doctors so they can talk this with the patient sitting in their office. So I think that's to integrate into the whole clinical workflow is very important, because otherwise I think those product will be just put it down. I mean, they will not continue to use it. I think that's one of the key differentiator from us, from the others. Thank you.
Yeah, one last thing I want to add. Thank you, Quentin. Sorry for the technical difficulty, and my room is out. But so I think the age of our company is actually the people's. Like Ghana and I, we have experienced tens of years in healthcare. I think we share a story. Like back in Epic, we will visit hospital like a couple times per year. We are not like go to the meeting room. We actually shadow the doctors, nurses, lab techs, 12 hours shift to know what they are doing. So when we say we understand the data, we are not understanding just the technical side aspect, the structure. We know actually how the data is generated in the hospital, how actually the care providers actually communicate using this data to provide the care. For example, like for one number in the chart, you just see, it's a patient number. Actually, it's a lot of people to work together to generate. Phlebotomy will draw the blood and send to the tube to the lab. Lab tech will prepare the test and put into analyzer, and then interface go back to the system, and the lab tech will sign off, and the provider will eventually see that data, and that data actually will finally into our system. So when we say we understand the data, actually we know actually the data when it's generated, what actually people will use this. We know the value. That gives us like a unique things. We have deeper understanding each data, what's the value of that, how actually providers using. So we can remove some noise of that and fine tune our model and algorithm to abstract insight and value of that data. So that's actually, I think, is our age. And that actually touch our mission of our kind of company. So the healthcare fundamentally is actually the humanity and the human indignity. So I think that's actually in passion and of our team members. We think the technology can help us to help the providers, every patient get the better healthcare they deserve. So I think we can contribute that. That's actually our team. Actually, a lot of team members dedicate their career, the whole career in healthcare industries after graduate. We never change. We actually focus on this area, and we want to contribute. So that's actually the bonding. Grew the team together and start this venture. Thank you.
All right, so I think I have the last question, and I think towards the end of your presentation, you said that the target is to get to your first paying customer this year. Can you tell us a bit more about kind of who you think this first paying customer would be? How much are they going to pay? A little bit more about the business models to help us to understand where the kind of money comes from.
Yeah, absolutely. Thank you, Gary, for this question. That's a great question. So I just want to share that actually happened last week. We had a great meeting with the Yale Cancer Center leadership. I think that meeting at the end, they have very clearly expressed that we want to have this system implemented within Yale, as soon as possible. I think that's, as I mentioned, that's part of the reason we wanted this to win this money, and we want to, I think we need some support to accelerate our operations here. So regarding the business model, I think the pricing model, we are finalizing, but for now, what we are designing for the pricing model, I think that's as a partner with Yale Smile Cancer Center, that's an open discussion that we'll sit down and talk about it. But for now, it's separate in two parts. So first part is by seats or by user, as an annual subscription fee to use the software. And the other part is by the number of patients we help identify, and they verify are eligible. So we will charge like a rate, for example, $20 per patient we help identify. And that's accumulate revenue, and it will be growing, keep growing, because we are doing more and more clinical trials, and the clinical trial are keep coming in. So if the organization are doing better job, the sponsor will always come into the good site to do more clinical trials. So that's growing and continually, generating revenue. To answer your question.
All right, thank you.
Thanks.
Thank you.
All right, thank you, Control Trial, and a big thank you to all the teams pitching today. Take a deep breath. The hard part is over. Judges, the hard part is just beginning for you. However, it's now time for you to deliberate. So audience, I'm going to whisk the judges to their deliberation Zoom room. Hold tight. If you have questions for the teams, put them in the Q&A feature. We will announce both the audience choice winner as well as the grand prize winner in roughly 20 minutes right here on Zoom. So please stay tuned.
Hello, everybody. Audience, thank you for joining us today. Finalists, those pitches were amazing. Well done, everybody. You should be really, really proud of yourselves and giving yourselves a pat on the back. So I'm just going to share a presentation while we're getting to the audience Q&A, the audience Q&A and the audience choice poll. So hang on. All right. Do you all see my presentation scrolling behind me? Thank you. Thank you. Wonderful. Okay, I apologize for the squeaking noise in my background. I have a seven-month-old puppy. At this time, I'm going to ask my colleague Sean if he can go ahead and launch the audience choice poll for the Miller Prize. Again, apologies about the squeaking. He's been really good all day. Okay, so at this time, Sean is going to be launching a poll. Only the audience can answer. I'm so sorry. You won't be able to answer. Audience choice winner gets $500. In this particular prize, we're trying to spread the wealth. So the same team that is chosen for the grand prize winner of the Miller Prize will not be chosen for the audience choice. So runner-up. All right. So let's see, I might have to make my colleague a co-host, so bear with me. Oh, great, and now the puppy is also barking, so you guys get to enjoy what I deal with, several times a day, every day. Okay, bear with me, guys. And away we go. Audience, vote for your favorite pitch now. I'm gonna leave that poll up for a few minutes while we field some questions from the audience. I know a few of you finalists were really eager to answer the audience questions. You had a lot of questions too. I might ask you some of your answered questions again. So going back to the Panluminate team, Matthew Hooper had asked, what is the customer profile for what you've described as an average scientist, i.e. who is the ideal early customer, where do they work, and how will they be able to validate the product? Panluminate, can you answer this question for our audience?
Sure. The average everyday user is your average biologist. These are people who work in either academia or biotech. They are usually trained in biology, biochemistry, molecular biology. The level of training is the same you acquire in college, so it's not any specialized. It's not specialized. Yeah, it's accessible to everyone.
Great. I have another question for you guys, Panluminate. So who holds equity in the company? Who owns the IP?
So my co-founder and I hold equity at the moment. The IP is owned by Yale. So this is Yale IP. We filed a provisional patent last year, and we filed a PCT this year.
So just for a little more clarification, does that mean that the university does not have any equity in the company?
Oh, the university also does have equity in the company.
All right, thank you, Panluminate. I have a couple of questions for Plasmo. Plasmo, will your editing environment allow for real-time visualization with lighting and environment creation, or will artists need to render in order to visualize?
Yeah, so real-time rendering is definitely in our future. We've actually already been working internally on a web-based real-time rendering engine. And by rendering, I mean ray tracing. So the technology that's made NVIDIA so famous as of late. But yeah, ray tracing on the web in real time is the next frontier for 3D modeling. And we definitely intend to ride that wave.
Great. I have another question for you guys.
Great.
Is your prototype ready?
It is. We've built prototypes of both Plasmo and Vulcan, the haptic glove, and you can check out both on our website, which I linked to in my written response to that question. So you should go out there and you should see our video. It explains the product better than I probably can. So
excellent. Thank you, Tim. All right, a couple of more questions. I believe, oh, this question is for control trial from Yifei. Apologies if I sort of butcher these abbreviations. Is OMOP CDM the only data source for control trial?
Oh, yeah. I think I just replied that question in the chat. It's called OMOP CDM. So I think she mentioned that she was seeing some information from the internet that this common data model was deprecated. But by far, I don't believe that's the case. It's a very active community that a lot of research centers are adopting that common data model. So please share with me where you find the information. But if that case really happened, I think we should be already develop our own common data model at that moment, because that's the model that for other healthcare IT company like InterSystem, they have their own common data model. The common data model is for the purpose that to guarantee our software will be automatically working once the data has been converted into the common data model. So we don't need to do a lot of changing, from the UI and from even the back end services to make sure that the software will be automatically working. And the work left will be converting, from different data sources in different format into the common data model. I hope I answer your question. Thanks.
Thanks, Guanan. All right, another question. This time for Team Flow, what are the risks associated with device installation and use, if any? Has it malfunctioned, caused damage, caused any other problems? Has anybody been injured? Hopefully not. Take it away, Flo.
Yeah, so the system installation is actually really simple. It takes normally less than 2 hours for any average roofer contractor to install it. We have not had any injuries or anything of that sort. It's really easy to install, and it uses essentially no specialized tools or equipment. And it leaves no marks or tracings, or it doesn't penetrate the roof at all, which would be counterproductive because then it would cause damage. But so we really are careful about that. And then the system itself is designed to really use a very low amount of electricity. We use less power than a light bulb. And that's intentionally designed because heating cables and things of that sort currently can cause building fires and really terrible damage. I mean, that's why Yale actually doesn't install any heat cables on their roofs, because they're afraid that's going to burn down the entire campus. And so we are really cautious about energy consumption. And then we also are cautious about our environmental footprint, which is why we're using a eco-friendly, non-corrosive, biodegradable, pen and plant safe de-icing fluid instead of magnesium chloride or glycol-based solutions that can really cause a lot of damage to the environment.
That does seem like a much more environmentally friendly solution, but then I have a question. So do you guys have to carry your own liability or property damage insurance?
So we carry,
I suppose liability, right? Not property damage.
So like any hardware startup, we carry a general liability insurance and a product liability insurance, but the installation is done by a third party. And I mean, it's like any other typical hardware startup in that sense.
Can you tell us more about the third party? How do you find contractors to do the work? and how are they qualified?
Yeah, so for this winter, we worked with a number of folks. We participated in our pilot in over 10 states. And so a number of these folks found us because they were just super excited about the product. A lot of these folks currently do installations for heating cables. They currently do roof steaming. And when they see our product, they're just like, I want to stop doing roof steaming today and just use your product instead. Roofing has one of the highest liability rates in the country. Roofing is one of the most dangerous professions in the country. If you know Michaela Schifrin, she's a gold medal Olympic skier on the U.S. ski team. Her father actually got killed because he got hit by an ice dam a couple of years ago. And so they're incredibly dangerous, actually. And so a lot of these folks who work for these roofing companies recognize that a lot of their guys really have some substantial injuries and they have to pay for it. And so for them to have a eco-friendly, safe alternative that they can install in the summer and maintain on the ground in the winter, it's a huge value prop for them as well. And so a lot of folks have reached out to them and said they want to transition their business over to essentially being a Flow certified provider moving forward. And the second piece is that a lot of our customers have, especially on the larger like B2B side, whether it's municipalities or multinationals, things of that sort, they already have their own roofing contractors in different parts of the country. And so we've worked with those providers as well. And it's been a very easy transition.
Got it. Thanks, David. Before I resume more audience questions, I just wanted to remind everybody that the Audience Choice Award poll is still running. It looks like most of you have voted, but if anybody's having trouble navigating to where they can fill in the poll, try hovering your mouse over the bottom of your Zoom screen. Sometimes the bar where the poll option is gets hidden. We'll end that poll in just a minute. So for anybody who hasn't voted yet, vote now. Okay, back to questions for the answer. Gife, you are just a phenomenal question asker. So they have another question for you, Flo. You mentioned not leaving a footprint for environmental impact, but have you considered the environmental impact of the creation of the de-icing solution?
Yeah, for sure. So we were very intentional about finding both a de-icer that is eco-friendly, non-corrosive, biodegradable, pen and plant safe, things of that sort. And then also finding someone who sourced it from a sustainable standpoint as well. And so we're actually working with one of the oldest green de-icer suppliers in the country. He's been around for decades now, based in Wisconsin. And they're actually called the Green Earth De-icing Company. And so it's very much part of their vision and mission to really be a eco-friendly alternative in a otherwise very, very dirty and energy intensive industry. And so they really make this part of their core value prop. The issue is that it's a lot more expensive to produce it this way, and the chemical itself is more expensive than, again, traditional glycol-based, magnesium chloride-based solutions. The nice thing about our system is that we're applying these IoT sensors in our data sets to really figure out exactly when should we be depositing this fluid and how much of it. And so instead of like dumping tons and tons of this fluid, we can really deposit a very small amount in less than 15 or 20 gallons per winter per average building. And so that really brings down the cost a lot and makes it a far more accessible product for customers across the country.
Great. All right, audience, we have time for more questions. I believe we might have a couple of questions left. Claire was asking Flo, do you and your co-founders own the IP? Does MIT have any stake in the company? I believe that was for Flo.
Yeah, we own the company ourselves. MIT does not have a stake. Flo owns all the IP as well. So yeah, we're separate from both universities.
Great. All right, those judges are deliberating away and they should be back soon. But at this point in time, I am going to close the Audience Choice Award poll. But audience, you have to stick around. I'm not going to share the results of it. All right. I've been keeping you in suspense. I'm going to continue to do so. So we will wait until the judges return. In the meantime, I'm still fielding more questions. Let's see what we've got. Question. Okay, nope, we've got some people trying to connect directly with our finalists, which is great. The Q&A function can also sort of serve as a way for people to opt into connecting with each other. So what other questions do we have? Oh, you know what? A question that I did in another one of these Startup Yale prizes earlier today. Each team, in the order that you pitched, can you answer for us What is the biggest obstacle that you're currently facing?
Current obstacle? Honestly, none. So we're pretty early on in the venture. I'd say the only thing that's critical is for myself to graduate soon. Yeah, that would be the only hindrance. I mean, once I got my degree, this is going to go forward pretty quickly.
And when do you graduate? Are you graduating this May?
In the summer, ideally by August.
Okay. And then you'll work full time on
Yeah.
Panluminate. Great. All right. Next team that pitched, what is the biggest obstacle that you're currently facing?
Yeah, of course. So we're pre-launch right now. So that biggest obstacle is obviously getting that first user. Getting that first paying user. You know, we have the beta users, we have the waitlist signups, but we don't have revenue, we don't have traction yet. So it's really going to be making that jump from something that, you know, people are testing out and people are using and it's adding value to their lives. And all our customer research shows that that jump is going to happen, but until it does, we haven't overcome it. So.
Great. Thank you, Telex. All right. I believe Flo is next. What's the biggest obstacle that you guys are facing?
Yeah, I could talk about that. So I would say our biggest obstacle is probably around COVID. It's been kind of tricky to coordinate with all of our pilot customers over the course of this winter, what with having to be remote. And I think that things are going to go a lot smoother now that everyone's kind of getting vaccinated and things are, you know, opening up and, you know, channels of communication are widening. So, you know, I'm super excited to, you know, keep those relationships going with those, you know, customers that we've gotten to know over the course of this pilot.
Great. Thanks, Flo. And control trial. What's the biggest obstacle that you're facing right now?
Yeah, I will say it's an obstacle, but I just want to highlight, I think the next priority on our list is to work with YNHH, with Smile Cancer Center regarding the pricing model they will feel comfortable so we can start our sales maybe by the end of this year or early next year. So I think that's the conversation, but I think we got, you know, at least first for now, enthusiastic about the product to implement. And also, I think we are getting some, you know, support from the accelerators that we're attending and about to attend during, you know, the Tsai CITY Summer Fellowship. So we'll get some experts on board and deal with the term and also, I think some contract negotiation things. So from there, thank you.
Thanks, control trial. All right, we're still waiting on our judges to return from their deliberation chambers. The anticipation is killing me. You guys are the final prize today, and we have 3 more prizes tomorrow. So I hope that the audience will join us. And I hope some of you finalists will tune in and, you know, root on your fellow entrepreneurs. And a reminder that you can use the Q&A button at the bottom of your screen to submit questions for the teams. All right, while we're waiting, I don't have any more business related questions for you guys, but what is one thing everybody is looking forward to doing or returning to normal, so to speak? With one activity that you're looking forward to returning to?
Abby, can I ask questions?
Oh, please. Yeah, the teammates, I mean, the finalists can definitely ask questions of each other or of me.
Yeah, I mean, I just want to maybe every team can share a little bit how they design their logos.
Yeah, what a great question, Guanan.
Yeah, I
Do you
can
want to go
start.
first?
Yeah, I can start. So I think you can see that for control trial this way. Yeah. So we are using a control button on your on the keyboard because we are a software company. I think that's number one. And also we are working on clinical trial. So that's where we got this two word combined together, and then we searched in the name.com, and this domain is available. So that's where we got this name initially. And also I think we want to emphasize this software is easy to use by just one click, the button, and then you can magically get the a matching from the clinical trial to the patients. I think that's the some philosophy that we want to share with others. Yep.
I love it. Does anybody else want to share about their logo?
I can talk a little bit about Flow's logo. Yeah, so I think the first month or so that I came on board, David and I were talking about getting a new logo, and so it was just a process of kind of iteration and sketching things on the margins of my notebook during class and stuff. Eventually, we kind of settled for this fluid droplet that also kind of looks like a roof with the chimney on it, and then a nice little snowflake on the middle for winter time. But yeah, pretty simple. Just kind of a couple of iterations on that.
Yeah, and for us, our logo, we were applying to this thing and needed a logo, and it was a few minutes before the deadline, so we just whipped it up in PowerPoint real quick, and it's arbitrary.
I love the brutal honesty. I see that the judges are returning, but I'm going to give Panluminate just a couple of seconds to answer if they want to about their logo, and then I'm going to hand it back over to my colleague Cassie.
I wanted the logo to be pink and pretty. That was aesthetically pleasing. Yeah, I don't have a good story.
No, I love it. That's great. All right. Thank you, finalists, for talking with me. Thank you, audience, for participating in the Q&A. Cassie, you can take it from here.
Wonderful, wonderful. Thanks everyone for sticking around. I was about to say welcome back. I guess I can say welcome back to the judges. The votes are in and we are ready to announce today's prize winners. But before I do it, I want to give this moment to say thank you to all of the amazing teams who shared your innovative ideas. Thank you to the judges for your insights and thoughtful deliberation. Thank you to Tsai CITY's team who's been working behind the scenes to make this event happen. And of course, thank you again to our generous donor, Brian Miller, for his support of Yale innovation. All right, down to business. This year's audience choice winner is Team Telex. Congratulations.
Thank you.
And finally, the grand prize winner of the 2021 Miller Prize is Flo. Congratulations, Flo. That concludes our competition today. Thank you all for tuning in. Don't forget to check out the other fantastic Startup Yale prizes that are happening. You can access the full schedule to Startup Yale at startup.yale.edu. The next pitch is the Rothberg Catalyzer pitch starting at 9:30 a.m. Eastern Standard Time tomorrow, same Zoom link. Thank you all.